Hello, I'm Dr Dawn Harper. Welcome back to the Stay Sure Wellbeing YouTube channel. And this time I thought I'd talk a little bit about blood pressure and air travel. Hopefully we will all be starting to get away on those long-awaited holidays very soon. And I thought, as blood pressure is such a common problem, perhaps we should talk a little bit about how that could impact and the best way to prepare for your holiday if you are somebody with high blood pressure. So let's start by talking about blood pressure. Ideally, our blood pressure should be less than 140/90. A single reading is actually not that relevant in that it is completely normal for our blood pressure to go up when we are anxious, in pain or exercising. But it's when blood pressure is consistently high that we worry that it could put a strain on the heart. So if your GP has found that your blood pressure is consistently over 160/100, they will start to think about medications to help to bring that down. If your blood pressure is between those numbers of 140/90 and 160/100, they will almost certainly want to think about lifestyle measures in the first instance. And that's things like losing weight, increasing your exercise, cutting down on your salt, addressing your diet to a healthy, well-balanced diet, and managing your stress. The thing about blood pressure is I often liken it to driving a car. So if you get into your car and occasionally you put your foot on the throttle and accelerate past an obstacle, that is a completely appropriate way to drive your car. If, on the other hand, you get into your car and every single time you drive it, you ram your foot on the floorboards and you throttle it wherever you go, then of course, ultimately, the engine will show some strain. And it's the same with blood pressure. It doesn't matter if our blood pressure goes up from time to time, but if it's consistently up, it puts a strain on the heart. And it's then when we start to see the complications of blood pressure, things like heart disease and strokes and so on, that we really want to avoid. So if you've been diagnosed with high blood pressure and say, for example, you are taking medication, then provided your blood pressure is well controlled, there is no reason why you shouldn't fly. I think you need to be mindful that if you're a nervous flyer, then of course your blood pressure is likely to go up. But as long as you are basically well controlled, there is no reason why you shouldn't fly. However, I would always advise that you answer any insurance questionnaires honestly, because if you haven't declared high blood pressure and you have a problem related to high blood pressure whilst you're away on holiday, then your insurance policy probably wouldn't cover it. So always be honest about when you were diagnosed, what treatment you're on, and that way you know that that condition is covered whilst you're away. I also always advise that you keep your medications with you in your hand luggage. And I usually advise that you take more medication than you would need to cover your holiday, just to allow for any possible delays. So take an extra couple of weeks with you. The NHS will allow you to have a 3-month script. So if you are travelling for a longer period of time and you need medication to cover that, then the NHS will give you a 3-month script. If you're going for longer, then you will need to find a local doctor to issue a further prescription for you. And with that in mind, I would remind you that blood pressure medicines have different names in different countries. So always take a copy of your repeat prescriptions. Ask your doctor for what we call the generic name of your drug, not the brand name, because that may differ from country to country. But if you take the generic name, the pharmaceutical name for your medication, then should you need a top-up, your local doctor will be able to give you the same medication, although it may have a different brand name in that country. And one other tip, whilst high blood pressure itself shouldn't stop you from travelling, I would very much advise against flying and travelling long distances until your blood pressure is under control. You don't really want to be in another country when you're trying to juggle treatments and side effects and so on. So if you've been recently diagnosed, wherever possible, I would postpone your travel until you know that the medicines you're on are A, working, and B, suit you, so that you can enjoy your holidays. So take care, enjoy whatever holidays you're booking, and I'll look forward to seeing you again here on the Stay Sure Wellbeing YouTube channel, answering whatever you want to talk about. So as always, please remember, do message me or email us anonymously from the website and tell us what you want us to talk about. Until then, stay safe.